Heart disease, the heart of the matter. Hearts have fascinated me for as long as I can remember. When I was little, I thought each of us had a mini Thomas Edison inside our body, electrifying light bulbs to help our hearts pump. Somewhat silly and wildly inaccurate, but I've long been captivated by the fist sized muscle that fuels our bodies and beats due to its own electrical system. Our hearts are amazingly powerful, beating about 100,000 times every day, powering 2,000 gallons of blood throughout our bodies, carried by a series of arteries and veins. We literally feel life through our hearts. They beat faster when we're excited or scared, and they beat faster to help us run or jump. This is part of what makes the epidemic of heart disease across the world so tragic. This most essential organ is increasingly tied to rising amounts of sickness and death. In the United States, more than 1 in 3 American adults have some variety of heart disease, and it's the number one killer of American men and women. It's expensive too. Heart disease alone cost the US $444 billion in treatments in 2010. That's close to how much money all the Walmart stores in the world earned in 2014. Heart disease is a wide category. It includes anything that hurts either the heart's ability to do its pumping job or our arteries and veins' ability to carry blood throughout the body. These are distinct from congenital heart defects, which include irregular heartbeats, tiny holes in the heart, and enlargement of the heart. Congenital heart defects are present from birth, often requiring surgery on tiny infant patients. We don't know a lot about what causes congenital heart defects, but we do know they're not triggered by the choices we make about what we eat or whether we smoke. Because clearly, infants haven't made any such choices for themselves yet. That's very different from what we know about heart disease. For adults, and also for kids, the choices we make about what we eat, how much we move around, and how we deal with stress all influence our heart health and risk for heart disease, partly by affecting things like blood pressure. Hypertension, or high blood pressure, heart attacks, cardiac arrest, and strokes are common types of heart disease and ones you've probably heard of, maybe even experienced in your own families. High blood pressure happens when a person's arteries narrow, forcing the heart to work harder to pump blood through them. Untreated or uncontrolled high blood pressure increases the risk that a person could have a heart attack or stroke. Most people with high blood pressure have no symptoms, so it's important to go to your annual checkups and encourage your parents, grandparents, and others to go for theirs, since blood pressure will be checked as part of those visits. Heart attacks occur when blood flow to the heart is blocked or even prevented, often because something called plaque has accumulated in the arteries. It's a similar process to when plaque builds up on your teeth if you don't brush them. Plaque results from, among other things, too much cholesterol and fat in someone's diet, and high blood pressure is generally a warning sign of clogged arteries, another reason to go to the doctor to get it checked. Arteries can become so clogged that very limited or even no blood can get through, including to the brain, which can result in a stroke. If you see someone who has numbness or drooping on one side of his or her face or arm and who is having difficulty speaking clearly, that person may be having a stroke. If you see someone experiencing chest pains or tightness, shortness of breath, or wheezing, particularly if he or she has a history of heart disease, that person may be having a heart attack. And women having a heart attack may have different symptoms than men, including fatigue, back pain, or an upset stomach. Strokes and heart attacks in kids are not common, but sadly do happen. Anyone of any age can call 911 and should immediately, or ask an adult to, if you think someone is having a heart attack or stroke. The sooner treatment starts, like providing oxygen and a mix of medicines to prevent heart damage after a heart attack, the better. When there's an electrical malfunction in the heart and the heart stops, that's called cardiac arrest. It happens very quickly and without warning. Adults or kids in cardiac arrest collapse, lose consciousness, and stop breathing. They also lose their pulse because their heart has stopped. In addition to calling 911, you can and should perform what's commonly known as CPR, shorthand for cardiopulmonary resuscitation, while waiting for emergency help to arrive. Traditional CPR has two main parts: chest compressions, pushing hard and fast on the center of someone's chest, and assisted breathing, blowing air into the patient's mouth. The American Heart Association now recommends that most people without advanced training, meaning most of us, perform only chest compressions. This is known as hands-only CPR. You can perform CPR correctly once you're at least 9 years old, provided you're strong enough, which is something a CPR instructor can help you figure out. There are online CPR course options that are available for free and can help you start learning about CPR. But it's not something we can learn through online videos alone. Just like we generally need to be taught how to ride a bicycle or kick a soccer ball. At least that was true for me. We need to be shown how to perform CPR so we know how to properly administer chest compressions. And then we need to practice a lot. Increasingly, states are offering CPR training at the high school level, and some states, including Arkansas, where I'm originally from, have started making CPR training a prerequisite for high school graduation. If you don't want to wait until high school, you can encourage your elementary or middle school to start offering CPR training to students who meet the strength requirements. The American Heart Association's bethebeat.heart.org is a good place for your school to find CPR lesson plans. It also has free resources for kids on learning CPR basics. Even knowing a little can save a life. Doctors recommend that it's better to try chest compressions than do nothing if you think someone is in cardiac arrest, provided that person is at least 8 years old. If you see someone in cardiac arrest, you can perform hands-only CPR and double or triple the chances of that person's survival. That's incredible, and it's something we can all be ready to do, and do even better with training, if we're strong enough.